Welcome to StantonMD. I'm board-certified emergency physician Dr. Ryan Stanton. In this episode, we will talk about pain, specifically the results of the opioid binge of the past 10 to 15 years with the resulting overdose, deaths, and fight to save lives. I will talk with the Lexington Fire Department and EMS about what they are seeing on the streets. We then turn our focus to the current shift in pain management, focusing on the cause of pain, not just masking it and putting people at risk. We spend time with pain management medicine and KORT physical therapy to see modern techniques of the treatment of pain, acutely and for long-term improvement in health. We start today with Lexington Fire and EMS. We have seen the results of the binge on opioids within and outside healthcare throughout the first decade of the century. Now, millions are addicted and thousands die each year. As laws cut down on the pills, heroin has surged with associated overdoses and now complicated by batches of drugs containing other powerful pain medications. As numbers grow, so does the strain on the system through manpower, medications, and resources.
Lexington Fire and EMS is no stranger to overdoses, but over the past few years, the numbers of heroin overdoses have skyrocketed. Whereas overdose deaths within Kentucky could be counted on your hands 10 years ago, now the annual death toll is in the hundreds and climbing. But this is just the tip of the iceberg. For every death, there are dozens of overdoses that require assistance to prevent another life lost. That assistance comes in the form of a reversal drug known as naloxone or Narcan. As of 2010, Lexington Fire was administering about 500 doses annually, or about 42 doses a month. Paramedic Justin Teetry tells us that's not the case anymore.
On average, 149 a month throughout the entire year. That's what we're looking at through the year. I believe 2015 it was 125 a month. So it's climbed a little bit over the past year.
Not only are the number of doses going up, but the amount required to save a life is rising as well.
Here lately, we've been noticing that it's taken more doses of Narcan. Now that's not every case, but it's taken more doses of Narcan to wake these patients up. Normally we'll give, we have IN, which is intranasal, which we have a device that's able to go into their nose and spray in each nostril. We also are able to give it IV, which is more potent. We've been noticing that we've had to give more than one dose. Normally 2 milligrams would wake them up, but sometimes we've had to give 2, 4, 6 milligrams before we're even getting a reaction out of them, before they're even able to wake up and start breathing on their own again.
Battalion Chief Brian Wood agrees.
Where we're at now is we're seeing the heroin's a lot stronger. It's being cut with fentanyl, so it's taking the normal patients to take 1 dose to wake up. Now we're seeing patients that it's taking 2 to 3 doses, and then even when we get them to the ER, they're having to put them on drips and administer even more.
I talked with a DEA agent that works in Central Kentucky. He is not able to be on camera due to his role in investigations, but he reports that the product is getting more potent and cut with higher risk opioids, including fentanyl. This dramatically increases the risks of overdose and death. He also reports that the overdoses tend to come in batches as new product hits the streets. Lexington Fire also sees the pattern.
It really all depends on the day. I mean, one day we can have, on this truck alone, we can have no overdose runs. We don't administer a single thing of Narcan. The next shift, we can have 5 or 6. I don't know if that's a trend of a pattern of when the drugs are coming in or the distributors are giving them out to the people. It just really all depends on the day and the situation when it comes in. I do know that when there's one, more than likely you're going to have an influx of it. So if there's 1 or 2 out in the city, it's probably been a bad batch. You're probably going to get 3, 4, 5 more that day. But it really just all depends on the day and the time and when they're coming in and when the distributors give them out and what it's laced with, which is unknown. You just never know when you're rolling up on scene. You don't know if it's laced with the fentanyl or with the elephant tranquilizer or if it's just regular heroin.
As the numbers rise, so does the strain on local governments and EMS services.
The challenges are the cost. Over the past 4 to 5 years, we've seen the cost spiral out of control. We've gone from, when I took over this position, from $4 a dose to we're at over $38 a dose for 2 milligrams of Narcan now.
It's becoming a greater strain on government coffers and increasingly hard for EMS services to cope.
Well, it's hard to budget. We have set physical limitations, and we still have to take care of all of your other strokes and cardiac events, car wrecks, and all the other emergencies that take on the city. With this increased cost that's kind of gone spiraled out of control, as I said, we have trouble keeping up with it. We're looking at spending approximately $60,000 just on Narcan this year, and all that money still takes away from our other budget that we have for our other supplies. It's already there where the cost is difficult to maintain. Last year's budget, we had to go back and ask for more because we actually ran out early due to the increased cost of Narcan. As for supply, I'm not sure right now. So far as we've checked, we don't see any shortages in the upcoming future, but we are in contact with local hospitals as they are in contact with us, so if they run short, they can get into our supply, or if we run short, we can get into their supply. At present, we do have plenty in stock.
But in the end, it's about saving lives, and both Wood and Teetry report they will do everything possible to ensure they are there when needed. There is a light at the end of the rainbow. After a near-death experience, some don't want any further help, but for others, it's a wake-up call and the chance at a new day. Recovery. Justin Teetry tells us what it's like when people are pulled back from death's grasp.
They're coming out of a seizure or a post-ictal state where they're confused, they don't know what's going on. We always encourage people to go to the hospital. I've had patients that don't want to go, that they're completely alert, they're oriented, and they don't want to go. I've had other patients that have been trying to seek help, and they know they're trying to seek help, and they are willing to go to the hospital. It's just it really all depends on the situation and the person. More times than not, people are willing to go to the hospital, and the biggest thing we try to tell them is, we've got help. We've got cards that are helping people to get to, whether it's a shelter or a hospital or someone they can talk to try to get off the drug. A lot of times when people stop breathing, we tell them, hey, look, when they become argumentative with us, we're breathing for you. Because a lot of times people don't know. When they go out and they stop breathing, they even have family members that are telling them, hey, you weren't breathing. If we like to tell them, hey, if we weren't here, you'd probably be dead right now. And it impacts people differently on what we try and tell them, what we try to say. Obviously, they have to get help. We can say all we want, but ultimately it's up to them whether they want to stop using or not.
In the end, victory will only come through recovery. As we understand more of the opioid abuse epidemic and its complications, it's clear that we must work towards expanding addiction recovery and preventing addiction altogether. More StantonMD coming right up.
Don't let cancer keep you from enjoying the little moments in life. KORT Physical Therapy knows those moments are important, and cancer doesn't have to slow you down. Studies show that people who routinely exercised had a 40 to 50% less fatigue rate and significantly decreased their risk of reoccurrence. KORT empowers you to take an active role in your recovery and get back to enjoying life. Whether you like summer cookouts, Little League baseball games, or a trip to the lake, KORT will design a plan to ease tightness, aches, and pains and increase strength and flexibility. KORT is there for you every step of the way. For more information, visit KORT.com. KORT Physical Therapy.
Do you own or work for a business that advances health and safety of the public or its employees? Then you may be interested in becoming a sponsor of StantonMD. There are various opportunities for sponsorship, from the show to the website, social media, print, or a combination. For more information on becoming part of StantonMD, contact Jen at info@StantonMD.com. That's info@StantonMD.com. Now, back to the show.
Welcome back. When you think of pain management, many think of medications, pill mills, and shady pharmacies. But that's just not the case. Many pain clinics attempt to treat pain at the source, utilizing modern techniques to address the root cause of the symptoms. This is the case at Pain Management Medicine, where Dr. Danesh Mazlumdost specializes in the diagnosis and management of pain disorders.
Dr. Mazlumdost is an interventional pain specialist with years of training to bring the most modern evidence-based techniques to the treatment of pain-related conditions, whether acute or chronic. He also understands the challenges we currently face with the epidemic of opioid addiction and now opioid-related overdoses. He talks about the transition in pain management and what started as the compassionate treatment and cancer care to a nationwide epidemic.
So I think if you go back about 20, 30 years, there was a large movement to address pain at the end of life. And somewhere along the way, that got transformed into pain at any point of life. And it became an overextension of what realistically medicine can accomplish. Because when you transform medications that are utilized for acute care into medications that are used on a daily basis, you start to lose its effect, and moreover, it starts to create other problems from a neurophysiologic standpoint that are irreversible and become very difficult to treat. In fact, if anything, the pain medications will potentiate and make the pain worse as time goes on. So it becomes a matter of understanding how to treat the pain appropriately rather than just kind of quieting the symptoms and waiting for it to progress further.
And with that came the opioid-based pain medications.
I don't think it started out as a nefarious endeavor. In fact, if anything, I think the opioid crisis is a perfect example of the road that's paved with good intentions. I think anybody who sees somebody that they care about enduring pain, they're by all means going to be, they're going to have a desire to do something about it, arrest it as quickly as possible. A lot of advocacy groups developed. I think there were a lot of special interests, like pharmaceutical industry, that saw this as a big cash cow. I mean, hydrocodone is the #1 prescribed drug in America. It exceeds medications that are used for essential hypertension, which is among the most common diagnoses in the country. So the fact that this became such a huge industry kind of self-perpetuated itself and became a self-fulfilling prophecy. The more pain medicine you write for, the more pain medicine patients crave, and it just keeps growing.
The problem is that opioids overall are a poor option for anything other than acute painful conditions. Dr. Moslem Doost fills us in on how opioids can be more of a problem than a solution.
The bigger concerns that I have with opioids, or that's panned out in research, is one is the tolerance that develops. The tachyphylaxis is what they call it. You gradually adapt to the presence of that opioid so that it doesn't really affect your pain anymore. The first time somebody takes a pain medicine, they feel amazing. And then a year from that point, they're not feeling the effects as much. And then 5 years from that point, they're not able to live a normal life without the presence of that pain medicine. That's one of the biggest concerns. The second is there's a contradictory effect from opioids. When you first take it, you get, if say for instance your pain is starting at this level, when you first take it, it's going to drop it down. But as that pain starts to come back, or as the medicine starts to wear off rather, your pain doesn't rest back at the starting point. It actually rebounds to a higher level of pain. And it takes much, much longer for that to realign with your previous pain state. Now, if it's an acute pain issue where you expect that the peak in your pain corresponds with the duration of action of the medication, then that rebound effect kind of balances things out. But when you're dealing with a chronic pain, if you're constantly fighting this swing, it's a whole lot harder to deal with pain when you're going from these really good times and to really, really bad times.
The key for pain management, especially chronic pain, is understanding and addressing the source.
So the way we go about things is we try to peel back some of the layers, develop appropriate expectations of what pain management is, what that life will cause pain, that you will have painful issues as you age, and that our job isn't to eliminate those. It's rather to try to keep you as healthy as possible and to undo some of the damage that is causing pain. Generally speaking, pain it's like your check engine light. It's not a disease. It's something that your body actually utilizes to notify you when something is not working correctly. And we got to understand what's not working correctly and how to best address that.
At pain management medicine, they utilize tools to help diagnose the cause of painful conditions and then modern modalities to treat the source.
Generally speaking, I take one of two roads with patients, and I explain this the first time I see them. There's a palliative road, which means that we're just simply trying to get you relief, and then there's a regenerative road, which is what we're trying to fix the problems that are causing the pain. And a lot of pain management has been focused heavily on the palliative road, just getting relief. And you can do that with reducing inflammation, with numbing nerves, or even ablating nerves, and that means just creating a gap between two ends of a nerve so that the signal can't cross that bridge anymore. And it's been effective. It's been very effective for many years, but what we tend to see is a revolving door. Patients will get better for a while, and then they'll come back. With the regenerative road, what we're trying to do is leverage that inflammatory system to actually push things in the right direction, to get healthier tissue in there, to try to recruit more stem cells, to expose the body to the types of growth factors that do draw in the repair mechanisms, and then leverage that with exercises, with rehabilitation, with stabilizing maneuvers that give the body a better chance at long-term healing, as opposed to just this repetitive pattern of pain.
When you walk into their clinic and office space, you don't see script pads and pill bottles sitting around. You see modern machines and exercise equipment. This may seem odd for pain management, but it's the key to accurate diagnosis and effective long-term treatment.
The interventional equipment that we have, it's all geared toward really understanding the pinpoint origins of pain and how we can rehabilitate the body and how we can get it stronger. Some of that requires, so I use two modes of interventions. One is fluoroscopy, which is an X-ray machine, and that helps me see hard tissue like bone, disc, joints, things like that. The other is an ultrasound, which helps me see soft tissue, things like muscles, tendons, ligaments, nerves. And a lot of pain it's a chronic degenerative state. There's a lot that can happen that can perpetuate the pain.
The key is to understand that pain, especially chronic pain, is not an easy fix.
I do tell people that the regenerative road is not a quick and easy fix. It took years for you to develop this pain. It's not going to take minutes for me to undo it. It is work on your end, and sometimes the pain does get worse before it gets better. After all, pain is your body's way of telling you to slow down, allow this to heal. And we can't just obliviate that and expect tissues to still heal and regenerate.
The key to pain management is not masking the symptoms or medications that put you at risk of addiction, worsening the pain and complications. Rather, it's understanding the causes and treating it at its source. Modern technology and practices are revolutionizing the treatment and helping countless who suffer from painful conditions. More StantonMD coming up.
Pain management medicine features cutting-edge technology to evaluate, diagnose, and treat pain. They address the source of pain and its contributing layers through a comprehensive approach with evaluation, fitness, and targeted procedures. Treating the source, they bridge the gap between functionality and pain. Doctors at Pain Management Medicine are subspecialty trained anesthesiologists well-versed in the latest technologies and techniques for addressing chronic, neuropathic, or cancer-related pain. For more information, visit painmm.com. As a board-certified emergency physician, Dr. Stanton is a proud member of the American College of Emergency Physicians, also known as ACEP. ACEP provides physician and evidence-based patient resources at its consumer website, emergencycare4u.org. That site has stories, fact sheets, and advice on a wide range of emergency topics. From visiting the ER to mom tips, you can find them on emergencycare4u.org. Now, back to the show.
Welcome back. One of the best treatment and preventions of pain is fitness and physical therapy. Unfortunately, in the U.S., obesity and deconditioning seem to be the norm rather than the exception. KORT Physical Therapy has a wide breadth of practice and therapy options, but the treatment of pain, especially musculoskeletal pain, is one of their main areas of focus. I spent some time in the clinic learning some of the tools and techniques that get folks back on their feet and active.
When someone thinks pain or an injury, they often think of rest and taking it easy for a while. But more and more research shows that return to activity, exercise, and fitness are keys to improvement and future prevention of pain and disability. Physical therapy can be a key tool to the recovery from painful conditions, focusing on the causes and the solutions.
Physical therapy is important not only for helping people to move again, which is one of our biggest focuses, is getting people back to their quality of life. But on top of that, we can help people get their pain levels down in order to be able to do what they want to do. So physical therapy not only is important for those things, but it can also help with tissue healing. So just like someone every day takes their pain medication in order to help with diabetes or heart issues, whatever it might be, same thing with physical therapy. So we can go in and we can change the actual tissue makeup of someone who has like even shoulder pain or back pain, whatever it might be, in order to get the tissues healthy so that they don't hurt anymore.
The issue is that decades of focus on pain medications has basically taken the proverbial eye off the ball of the best options for recovery.
I think people in general, and I remember before I was even a physical therapist, they think that, well, I need to go to the doctor, I need to get on some pain medication, and this will just go away. But that treatment program does not always fix the problem. Generally, if people have low back pain, they go back to the doctor again, and then again, and again. And it's this recurrent cycle that occurs without fixing the actual underlying problem. So with pain medication, that can oftentimes just be a Band-Aid that we lay over the problem so that people can kind of get through, but it doesn't fix the issue at hand.
And the treatment of pain is not always a quick fix.
Like pain goes, generally there's not always just an injury that occurs that causes the pain to happen. Some people will wake up in the morning and all of a sudden they're in pain. And so they ask me, how did this happen to me? What did I do to make this come on? And I say, I'm not sure, but I do know that when you don't move, when you're sedentary, when we age, things start to degenerate. And with that, we have to go through this regeneration process of doing specific training, specific exercises in order to get that tissue to heal properly again.
Probably one of the greatest sources of chronic pain in modern life is cancer. At KORT, Erin has been closely involved in the treatment of Bobby Strong. Bobby was diagnosed with stage 2 breast cancer, and by the time she had surgery, it had advanced to stage 4. With all of the treatments and toll of cancer, Bobby had significant pain and physical limitations.
Fatigued. On top of that, she says that she cannot use her left arm, essentially. So it's so weak from having had so many lymph nodes removed that she can barely use her arm. On top of that, she's got pain running from her arm all the way up into her armpit and pulling, pain and pulling. And there's actually noticeable portions of her tissues that are kind of lumped up and very tight.
Because I didn't have grip strength, it pulled, it was really tight, it hurt all the way into my armpit, it was painful. So, and I couldn't even hold my son, so I was like, okay, I'll go. But yeah, I was scared at first.
Through persistence and hard work, Bobby has made significant improvement.
Since I've been coming here, Erin's been making me work out every muscle possible in my arm, and then massaging the scar tissue, and I still have to do that even at home. Now I think my grip strength is 75 in my left arm, and then as I couldn't stretch my arm out like this or even get anything off of the shelf without it hurting and pulling. And now I can do everything with my left side that I can do with my right.
She also reports that her pain has consistently improved.
The pain, every single time I came, it just eased up every time. And then, I would talk to Erin, or I would text her and be like, hey, this is going on. I may need to come in and see you. And she's like, okay, come in. You just let me know. We'll work that out. So that's been nice that I have her, so convenient.
And why is that so important? Because Bobby is a young, active mother with children that won't stop because she is in pain or not feeling well. Bobby had to get better to regain her independence and excel at her role as a mother.
I think if I hadn't come here, I would still be in the same position, still struggling to take care of him. Because I was having friends come and stay with me, my grandmother, my parents were taking off work, my husband would take off work to come and just sit and help me throughout the day. Because I couldn't do much of anything without struggling, And now that since I've been here, it's all like the pain is not there anymore, just the pull every now and then. But I've talked to Erin about it. I think I'm going to come back in and just have her check it out, make me do some more exercises.
But it's not all about the exercises and work. Healthcare, physical therapy, and KORT are also about having someone to help you through a difficult time.
She's just needing someone to educate her and talk to her and just walk her through that process. I mean, Bobby has my number, we talk, or she asks me questions, and kind of even, I guess this was earlier this week as I was talking to her, I was going, did you get those results back? Any news, any updates? So it's just nice, I think, to have someone in your corner to talk them through something that we understand from a different standpoint, but I also understand on a compassionate human level and care about her and want the best for her.
In the end, Bobby has a message for those that may not have considered physical therapy as an option for the management of painful conditions.
Honestly, I would highly recommend anybody with cancer pain or without, if you're in pain at all whatsoever, I would recommend, hey, you need to go and do some exercises, or even have knowledge of stuff that they can do at home if they don't want to come, to KORT. But I would just say it's helped me. I don't know why anyone wouldn't want to. I don't want to sit and hurt, so I would just tell people they need to come.
As they continue to work towards better health, function, and fitness, Erin and Bobby have teamed up in a battle against cancer. Bobby may have a long road of questions and recovery ahead, but she is committed to being the best patient and thus the best mother she can be.
Physical therapy should be a consideration for many types of musculoskeletal pain. If you have a painful condition, ask your doctor if they feel you would benefit from a PT referral. That's all the time we have for this episode of StantonMD. Thank you for joining us, and I hope you'll make us part of your routine for medical information, knowledge, and stories. You can catch up with past episodes and segments through our website, StantonMD.com, as well as through the StantonMD YouTube channel. I also invite your comments and suggestions via email at info@StantonMD.com. Follow us on Facebook and Twitter with the StantonMD Facebook page and at EverydayMed on Twitter. Until next time, I'm Dr. Ryan Stanton, and this has been some StantonMD.